Hi, it's David here from MyPhysioSA, and today we're catching up with Kirrily Chambers, and she's a Credentialled Diabetes Educator. So we're going to ask lots of questions about diabetes and hopefully get some great advice and tips for you. Kirrily's been a diabetes educator for many years. She's a pharmacist as well, and she won a very prestigious award last year, the National Diabetes Educator of the Year. So welcome. I've got a few questions for you today so we can help everyone out. So we all know and have heard about diabetes, but most of us actually don't really know what it is. And some people think it's, if you're on a sugar low and you've got to have lollies, and they hear about people injecting themselves, stuff like that, getting it in pregnancy. So can you give us a rundown of what diabetes actually is?
Yeah, sure. So if we look at this chart that I'll acknowledge Sanofi, insulin's a hormone that allows the glucose that is broken down from your food to move from the stomach into the blood. Now glucose shouldn't sit in the blood because that's where it can do a bit of damage. It needs to move into the cells, and we're made up of cells. To be used as energy. The problem with that is that it needs a key to open a door to allow that glucose to move into the cells. If it doesn't have that door open, then it can't move into the cells. And insulin is the hormone that's made in the pancreas to allow that movement of the glucose into the cells. Insulin's made in the pancreas. There are 3 different types of diabetes. Type 1, which used to be called juvenile diabetes, where there are no keys made. And that's an autoimmune disorder. So the body wakes up one day and decides it doesn't like the keys or the cells that are being made and kills them. Then there's gestational diabetes, and that we think that happens because of the hormones that are made during pregnancy. And then there's type 2, which is the major type of diabetes that we see, which used to be called mature age onset. We don't call that anymore. And that's where, 1, there's not enough keys being made as we all get older. 2, in 85% of people that get type 2 diabetes, there's putty in the keyholes, if you like. That's in the form of fat. And the third thing is that there's usually a genetic predisposition, and that means that you can have a family history. And what we relate that to is the keys are rusty, if you like. So that's the best way to describe what types of diabetes are going on. So type 1, type 2 and gestational.
So what sort of symptoms does diabetes give you?
So what usually happens is, because the glucose can't move into the cells, what happens is the glucose builds up in the blood. And the body knows that that's not okay, and so it tries to get rid of it. So people will usually have frequency of urination, so they'll go to the toilet more. People don't normally notice that during the day, but they'll notice that a lot at night. People get very thirsty. They'll have blurred vision sometimes because you don't need the keys to open the doors to get the glucose into the eyes, so people notice blurred vision. And people will get very tired because you're not getting the energy from your food. So people feel very fatigued, particularly later in the afternoon, and so people might sit on the couch after dinner and drop off to sleep. And the other one is wounds that don't heal. So lots of scratches and stuff that don't heal.
So they're the symptoms you get. Can it cause damage if it's not controlled or diagnosed?
Yes, it can long term. So again, glucose is not something that needs to be sitting in the blood, it needs to move into the cells, and glucose can cause damage to nerves and the eyes and the kidneys and the heart and lots of other places. But that's only long term, so nothing to be frightened of. If we manage diabetes, and we can very well with medication and physical activity, and also healthy eating, then usually diabetes can be managed very well with no long-term consequences most times.
So with the type 2 diabetes, that is more common as people get older and can be triggered from lack of activity, being overweight, those sorts of things?
So that they are some of the causes. There's also that genetic predisposition as well. But one of the biggest things that we can do to help people is some physical activity. So, you don't have to necessarily join gyms if you don't want to, but just incidental exercise, what we talk about, parking the car further away, taking the stairs when you can, and also just general healthy eating, reducing portion sizes, adding vegetables, eating fruit every day, those type of things, the things that we talk about every day, healthy eating, physical activity, they will help and go a long way.
So there's a test that GP can do, or you can do, that would determine if someone's at risk of getting diabetes or has early start phases of it?
Yeah, so there's a couple of tests that we can do. There's one that's called the Australian Type 2 Diabetes Risk Assessment, and what that does is it adds up lots of little things like, do you have a family history, do you have hypertension or high blood pressure, how many physical days do you do extra physical activity, those sort of things, and it gives you a number at the end of that. And then there's the low risk, medium risk and high risk, so it takes into account your family history as well. And there's also a fasting blood glucose level that we can do, which will predetermine whether you potentially have the pre-diabetes. And that's a really interesting one, because if you have pre-diabetes, a 1 kilo weight loss will decrease your risk of getting diabetes by 16%. So that's a massive number, really, isn't it?
Indeed. So you'd have to go see your doctor and chat to them about things, or sometimes this gets picked up as part of regular routine bloods and stuff like that?
Regular screening. So it's now common in a full blood count to have a couple of examinations to see whether you've got diabetes. It's quite common now. And the risk assessment tool can be done in most pharmacies, so you can take that to the doctor and have a conversation.
Okay, so what other things do we need to think about that might have an influence with diabetes? So blood glucose levels. So diabetes is all about trying to manage within a certain range with your blood glucose, so you don't get your symptoms. So what sort of things can affect blood glucose?
So there's lots of things will affect blood glucose levels. Most people think it's just about food and physical activity, but stress is a big one. Stress will impact blood glucose levels. Medication, obviously, so there's medication that will lower blood glucose levels. But there's also medication that will impact on elevating blood glucose levels.
So that's just incidental medication they're taking for other things?
Yes, some of the medication that's taken for pain management, for example, corticosteroids is a big one that will impact blood glucose levels. So there's lots of things that will impact both, that will elevate and will lower blood glucose levels as well. So that's very important. So
I guess that's why there's diabetes educators and pharmacists know a lot about it as well, to make sure that everything's looked at as one big picture. It's not just looking after your diet or having to lose weight. It's
correct, and that's why people with diabetes have a whole allied healthcare team. And it's very important that they go and see those people on a regular basis to make sure that we're helping manage and prevent long-term complications.
So what sort of tips and advice are really key things you think would be good to educate everyone about today? So again, if people are in the pre-diabetes state or they're worried about their diabetes, there's lots of things that they can do. There's no such thing as a diabetic diet anymore. We don't put anyone on diets. We talk to people about healthy eating, physical activity, because that should be the mainstay for everyone, regardless of whether they've got diabetes or not. Managing and preventing diabetes should be the same, regardless of whether they've got diabetes in the family or not. Everyone is at risk of getting diabetes because we lead such sedentary lifestyles now. So it's really important that whether you have diabetes in the family or not, that we all work towards the same goal, which is keeping healthy, lowering weight, doing some physical activity, and ensuring that we reduce portion sizes, and getting regular health checks. Regular health checks is very important, because if we know what's going on, then we can do something about it. Oh, that's great. So if someone sees this video and wants to have an appointment with you, where are you available? So I'm based at Stirling Day-Night Pharmacy, and that they can come and see me, and they can go to the doctor and get a referral if need be. Anywhere else? Blackwood Green Dispensary, Green Dispensary at Stirling, and also Erindale Green Dispensary. So spread out kind of all over the place.
That's great.
Well, thanks a lot for talking to me.
You're very welcome.